The United States has seen more mass shootings in 2022 than we've seen actual days so far this year. Astounding statistic. The Gun Violence Archive says Tuesday's massacre at Robb Elementary School marked the 213th mass shooting this year. But the Texas shooting, of course, the most deadly. Joining us now is Dr. Celine Gounder. She is an editor-at-large for public health for the Kaiser Family Foundation's Kaiser Health News, also an infectious disease specialist and epidemiologist at both the New York University School of Medicine and the Bellevue Hospital. Dr. Gounder, thank you for being here. Public health crisis almost feels like an obvious yes, but your impressions about this concept that we are facing a public health crisis?
I think language really matters here, and I think reframing this as a public health crisis, I'm an infectious disease specialist. Many of people in my field have actually turned to gun violence, recognizing that gun violence behaves like an infectious disease. It is contagious. Violence is passed on from person to person. And framing this as a debate of gun control or talking about gun control, I think is also really polarizing as well. It implies a very narrow range of solutions, and we need to be thinking very broadly here.
So maybe you actually get more people in the tent if you're talking health as opposed to Second Amendment issues.
Exactly. This is about, yes, gun control is a part of it, but it's not gun control or mental health. It's not even gun control and mental health. There are so many other things we can be doing, ranging from violence interrupter programs, stabilizing people who are most high risk to be involved in gun violence with social and economic supports, addressing community blight. So there's so many different solutions here that we need to pair together.
You said at the top that language matters. I just want to read to you. The CDC quotes an American public health expert in defining public health on its website, defined as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. So, as a rule, when you start considering that, does it fill you with any hope at all that you can, once we start talking about this as a public health issue, reach more people?
I think so, and I think public health also starts with data, of measuring the problem, understanding where the problem is worse, what are the risk factors. I think, as one example, mental illness. If you were to eliminate all schizophrenia, bipolar depression, and regular depression, you would only reduce violence by 5%. If you were to eliminate all substance use, alcohol and other drugs, you would reduce gun violence and other violence by 35 to 40%. So understanding what to actually target here is really important.
And I imagine when you start looking at other cultures, other Western industrialized cultures, there's mental illness there too, but they don't have the rate of gun violence that we're seeing in this country. So therefore, you have to sort of bring in additional areas of examination. What is the role of any doctor, pediatrician, any doctor that kids are seeing, families are seeing, the individual practitioner? What's their role to play in this?
Well, a really key role is about counseling. Counseling patients, asking, just like I would ask, do you ride a bike or a motorcycle? Do you wear a helmet? Similarly, do you have guns in the home? How are those stored? Are those locked up? Is the ammunition stored separately from the gun? Those kinds of questions are really important here. And there's also a role for clinicians, perhaps, in referring patients who are in crisis for those court-mandated red flag laws when they identify somebody who really does need to be separated from their guns temporarily. It
really is a staggering place in which we all find ourselves, but for those interested in public health, it must be particularly the most challenging issue you've confronted in your career, I would think.
It's one of the more challenging ones. I think it's really important that we not lose hope. I think as soon as we become cynical, we become apathetic, there are evidence-based solutions. There are things we can do. And so it's really important to use the energy and attention on the issue right now to try to pass some of these laws, to come together and try to institute some of these community programs.
There seems to be such a spiking level of despair. I think giving people some hope or some approach to examine this issue at is something that's very important for people to cling to at this point. Dr. Celine Gounder, thank you for being here. Appreciate your time.